Show. I'm Greg Riccardi here with my co-host Dr. Richard Call and our special guest here, Dr. Doug Spiel. It's interesting that it kind of seems like, not being in the medical world, kind of seems like you guys are in your own world doing this kind of fighting and positioning and stuff, but most people, I wouldn't know about it.
That's why we're talking about it on the radio.
Well, the patients don't know.
Right.
And with all due respect, when you walk into a doctor's office, you see a couple of diplomas. Hopefully he greets you and has a nice word for you when you come in, and you feel comfortable when he sits down or she sits down with you and tries to explain the procedures. The level of expertise is very difficult to share with a patient and to get them to know what you do for a living.
Right.
And quite honestly, when they look in their handbook of doctors, my Blue Cross handbook and Blue Cross Blue Shield says, there are 6 doctors in this area that are listed, you're not listed.
But I'd like to make a point that I made before, actually, one of the early shows, Greg, about something that Doug is just bringing up. There are doctors and there are doctors, and just as there are artists and artists, some people have a greater innate ability to perform procedures than others.
How do you, as a patient,
Well,
figure that out?
It's impossible
Okay.
to figure out at first consult. And this is the point that I made before. The best way to know that is word of mouth, a referral from somebody who has had the procedure done. That's the best way to do it.
Okay. And how, if you have something that's you've never had before, how do you find someone who has had it?
Well,
I've had a cold before. I can ask my friend, hey, I know you've had a cold.
More
What
and
do you
more.
do for it?
more and more we're seeing a lot of stuff on the web now.
Mhm.
Yeah.
So we're seeing testimonials on the web, we're seeing blogs, we're seeing everything sort of viral. It's a new age. And as a physician, I'm trying to now embrace that new age. And certainly, we weren't taught that in medical school. We're trying to grow with the times.
Yeah.
And it's important, there's no greater honor that can be paid to you than having one of your patients or even a doctor or nurse that you've operated next to send you someone from their family. And those things, no greater honor. And it's a terrific feeling, by the same token, to go in and treat somebody and get them feeling better a week later and say, wow, my pain is gone. So I think we're trying to broaden ourselves to the viral web, because that's the new age.
Yeah, people, Doug is absolutely right. The first place that anybody goes today for anything about anyone or any subject is the internet. And they'll go on and they'll put in the correct Google terms, and a whole lot of information will come up. But even within that digital content, what Doug has just said is correct. If you've got other patients or other doctors talking about the work that a physician performs, they are the best advocates for the patients.
I know that there's these magazines, at least in the Bergen County area, where they've got best of the best, best of Bergen County, stuff like that. I don't even mention magazines.
Those are tough. Those really...
Listen,
those are supposedly. In fact, I know a market research company. It's actually, I'll say, Left Line and Associates, a good friend of mine, Bobby Left Line, and they do these tests or these surveys where they will send out the letter or a form to doctors within a certain category, whether it's a dentist or there's a surgeon or whatever, and they'll say, vote for your peers in terms of who you would, recommend.
Okay, but hold on a second.
Yeah.
Okay. I'm going to say this. I'm going to be, bold, right? I'm going to be bold about this. Those things are a joke. I'll tell you why.
Okay.
I'll tell you why.
Why?
Okay? Because sending out a form to all these guys and saying, vote for so-and-so. Okay?
Right.
Most of those guys have never been in the operating room with the guy who's doing the procedure. Right? They know him socially. They know him to go out. He's a good guy. Yeah, we go bowling. Those are the kinds of things. Their sense of who the person is. What you want is people who have had the procedure by these doctors to vote. They're the relevant votees, not the physicians.
Well, I was just kind of saying it's based on what you just said a second ago, Doug, where doctors refer other doctors, and that's how you know when someone is...
Well, some of us don't fit in any of those catchment groups.
Uh-huh.
So I don't know of any radiologist that'll vote me a radiologist that does endoscopic spine surgery. And similar to that, I'm pretty sure that no orthopedic spine surgeons are going to vote for me in their group.
That's what I'm saying. That whole thing is a joke. It's an old boys club coming together, voting their friends in. It means nothing, right? To go to the issue of how do you find a good doctor who can do the procedure well, like Dr. Spiel, it comes down to patience.
Mhm.
Like, somebody who's had the procedure done and has done well. That's what you're looking at. And for example, I don't know the exact numbers that Dr. Spiel has performed over the years, but I'm sure they're into the thousands. And if you look at his statistics, his outcomes, his complications, I'm sure they're excellent. Those are the types of things you want to look at. Those are the numbers, the data, the hard data, that will tell you if a guy's good, bad, or should be sent to Cuba.
Well, now that the door's open to Cuba, actually, you're probably not doing him a disservice by saying.
Well, they sent over theirs, right, in the 1980s on the Mariel boat lift.
Excellent. Well, listen, on the other side of the break, which we're going to have in a second, you brought some toys with you.
I did.
That you're going to have to, folks, you're going to have to look at the website, myfavoriteshow.com, to see what Dr. Spiel brought with him. And we're going to go to commercial break. We'll see you in a few minutes.